What is metabolic syndrome? Metabolic syndrome is a collection of conditions that increases a person's risk of heart disease or type 2 diabetes. How is metabolic syndrome diagnosed? A person must have at least 3 of these 5 criteria to be diagnosed with metabolic syndrome. 1. Waist circumference for abdominal obesity. A waist circumference of 102 centimeters or more in men and 88 centimeters or more in women. That's one condition of the criteria. 2. Fasting blood triglycerides. In the blood, there are fat-like molecules which are called triglycerides. If your triglycerides are higher than 150 milligrams per deciliter, you have high triglycerides. 3. Cholesterol levels. The good cholesterol is the HDL or high-density lipoprotein. This is because high HDL levels reduce your risk of heart attacks and other health issues. If your HDL cholesterol is less than 40 milligrams per deciliter for men and less than 50 milligrams per deciliter for women, you have low HDL cholesterol. 4. Blood pressure equal to or greater than 130/85 millimeters of mercury or drug treatment for high blood pressure. 5. Fasting plasma glucose or FPG equal to or greater than 100 milligrams per deciliter. Sugar is required for all your body cells to function properly. Sugar enters the cell with the help of the hormone insulin. Sugar builds up in the blood if there is enough insulin or if the body quits responding to it. You have another point of metabolic syndrome if your blood sugar is greater than or equal to 100 milligrams per deciliter after you haven't eaten or drunk for 8 hours. What is the impact of metabolic syndrome? The metabolic syndrome is a collection of risk factors that increases the risk of heart disease, diabetes, stroke, and other health issues, as well as the likelihood of significant and long-term complications. Hardening of the arteries, atherosclerosis, diabetes, heart attack, stroke, non-alcoholic fatty liver disease, peripheral artery disease, cardiovascular disease. What can be done to avoid metabolic syndrome? Losing weight if you are overweight, eating lots of fruits, vegetables, and low-fat dairy products but not a lot of meat or fatty foods, walking or doing some form of physical activity most days of the week, and in general, being as physically active as possible, and quitting smoke if you smoke. All of these practices can all help you avoid metabolic syndrome. How is metabolic syndrome treated? Diet. Try some weight loss diets that are healthful. Incorporate a Mediterranean diet rich in fruits, vegetables, nuts, healthy grains, and olive oil as it can help you lose weight, lower your blood pressure, and enhance your lipid levels. The DASH or dietary approaches to stop hypertension diet. This is a low-salt, low-fat diet. It consists of 4 to 5 servings of fruits and vegetables each day, as well as 2 to 3 portions of low-fat dairy products. This diet can help you lose weight, lower your blood pressure, and enhance your cholesterol levels. A high-fiber diet. Increasing dietary fiber to at least 30 grams per day will help you lose weight and decrease your blood pressure. Beans, grains, veggies, and fruits are all high in fiber. The amount of fiber in each serving can be found on the nutrition label of packaged goods. Exercise. Doctors advise that patients exercise for at least 30 minutes every day, 5 days a week or more. If you can't commit to 30 minutes of exercise at a time, try 10 minutes 3 or 4 times a day. Brisk strolling is a wonderful option. Medicines. Medicines to reduce blood pressure, blood lipids, and blood sugar are also frequently prescribed by doctors. If you have any questions about the video, let us know down in the comment section below. And if you want to learn even more about health and fitness, be sure to turn on your bell notifications so you'll get updated when we post new videos. If you liked the video, please click the like button and share it with your friends. Also, you can go ahead and click the subscribe button as well, because we have tons of other videos on our channel we think you'll enjoy. Thank you so much for watching all the way to the end. Have a blessed day and stay healthy, my friends.